Okay, so let's talk about neck pain. I've had neck pain myself, and I have to tell you that one of the main drivers for this is the position you're in while you're maybe working or sitting down, which is usually a very compressed position, okay? And the neck pain usually starts from your thoracic spine, from your rib cage, because this is the foundation of your cervical spine. Just look at how your body, your rib cage is compressed and what it does to your neck. It cranks the neck, it puts a lot of pressure here, and you're basically in a hyperextended position with your neck, and for sure the neck extensors are gonna be hurting due to this. So the solution is gonna start by aligning your rib cage and even your pelvis so that the head that is stacked on top is gonna be in a better alignment. And stretching is a part of it, but just stretching your neck is not gonna solve the problem long term. Having forward head posture is one of the most important findings because of what it can influence both at the top and at the bottom. And by that I mean your jaw position, the way you're breathing, and even the position of your pelvis. Also, your head weighs about 4 to 5 kilograms, but every inch of forward head posture puts a lot of pressure on your neck, and it can get even to about 20 kilograms of force. So as long as the foundation of your neck, which is your rib cage and implicitly the pelvis, are not well aligned, you will never really solve neck issues if you just stretch it or massage it. So what I would do is actually start from your feet, because there's a superficial back line which runs from your feet up to your neck, and I would first relax that, and then I would do the exercises that I'm gonna show you. First, you need to work on the foundation of the head, which is your thoracic spine and your rib cage. For this, we're gonna do a breathing drill. You're gonna lie on your back, you're gonna have your feet flexed. From here, with your hips, you're gonna do a posterior pelvic tilt. What does that mean? If these are my hips, you're gonna tilt them this way so that your lumbar spine touches the ground. From this position, you're gonna put your hands left and right of your rib cage. You're gonna inhale, and when you exhale, let your rib cage compress. You're gonna feel your hands going towards each other, and you're gonna feel your abs contracting a little bit. So it looks like this. As you have seen, my hands went both down and towards each other. You're gonna hold this tension. You're gonna breathe only through your nose, and slowly you're gonna feel how your upper chest is gonna dilate. The air is gonna be pushed in this area because it can't go down anymore, and it will start dilating your whole rib cage, which is gonna create an excellent environment for the next exercises. The next breathing drill is gonna be one where you're on all fours. You're just gonna keep this position with your weight slightly more on your hands than on your feet, and you're gonna start breathing, feeling first that belly inflate and then your chest. Do this for 10 to 15 breaths, and then continue to the fascia drill, where you start with the ball underneath your toes. So I would first start by massaging the plantar fascia, and I'm gonna use either a tennis ball or a lacrosse ball, as I have. You're gonna put it on the ground, and from here, by applying pressure, you're gonna roll the ball from your toes towards your heel. Do that on a couple of lines that run through the plantar fascia, and do this for a couple of minutes on each side. After you finish with the plantar fascia, you're gonna sit and you're gonna put the ball on your calves. And here you're gonna do the same, apply pressure, slowly glide towards the upper part of the calves, and then back down. Do this also 2 minutes on each side. If you find places that are more contracted, do spend a lot more time on that area, because it travels directly towards your spine. Then you can continue with the hamstrings. From here, same principle. You're gonna slide on it, and if you find spots that are more tensioned, do concentrate on those spots. Maybe just apply a little bit more pressure and start breathing. Okay, and after you finish a couple of minutes on each side, you can then advance to your lumbar erectors. Here you can either use the tennis ball, or if you have the possibility, you can use two balls which you're gonna put together with some duct tape, and you're gonna have like a nugget type of massaging tool. Here you're gonna first lay on your back, you're gonna get your hips up and place the two balls on the muscles that are left and right of your spine. And here you can either slowly roll on the ball. If you find places that are more contracted, again, you stop there, you breathe in, exhale, breathe out, let that tension slowly fade away. And you can do that on the whole spine until you reach the neck. Once you get to the neck, either with this one, but I do prefer the lacrosse ball, massage your cervical extensors. Okay, so you're gonna put the ball right underneath your skull, and first you're gonna rotate your head left to right. If you find places that are more contracted, again, you can stop there, breathe in, exhale, breathe out, try to relax. Again, you're gonna do a little movement left to right, and you can put afterwards the ball just a little bit lower. Do this on each side, and again, spend 2 minutes. After finishing the myofascial release, you can now stretch your neck extensors for a couple of seconds. You're gonna put one hand behind your head and the other one at your chin. This one is gonna push your head backwards, while this one is gonna push it slightly forwards. You're gonna keep this position for 15 seconds, then you're gonna relax 15, and you can do this 3-4 times in a row. Now that you have relaxed all the muscles and you're in a state where the neck stimulus is gonna work better than it has before, you're gonna lay on your back and you're gonna want to train your deep neck flexors. To do this, while standing on your back, you're gonna put the tongue on the roof of the mouth. You're gonna put the whole tongue and not just the tip. That's very important. And you're gonna apply slight pressure on the whole roof of the mouth. While doing so, you're gonna slightly tuck your chin in, just a couple of centimeters, not too much. And you're gonna keep that tension, which you're gonna be feeling it in the depth of your neck, for about 30 seconds. After 30 seconds, you're gonna release for 10 to 15 seconds. And I want you to repeat that at least 6 reps. This way, you're gonna accumulate 3 minutes of time under tension, which is the least necessary time in order to create some muscle endurance in your deep neck flexors. Although the best way to train those deep neck flexors is by going through the whole process. If, let's say, you're at your job, at your desk, and you feel that tension behind your neck, I want you to go through these 2-3 sequences. So first of all, from your crouch position, I want you to extend your spine. And first of all, breathe. You're gonna put your dominant hand on your belly and your non-dominant hand on your chest. And you're gonna do some diaphragmatic breathing. You're gonna inhale. You're gonna feel your belly rising first, but you also need to be feeling your upper hand rise as well, okay? I want you to expand your thoracic spine front to back, and actually it's even a 360 degrees breath where you can also feel your ribs expanding on the side. But first we're gonna concentrate on breathing both in the lower abdomen and in the chest, okay? 5 breaths. So belly first, then the chest. After you do that 5 times, you can put your fingers at your lower ribs and now inhale and feel those hands expanding. After you do the breath, then you can stretch your cervical spine a little bit. After we hold this for 15 seconds and do it 2-3 times, you're gonna start training those deep neck flexors, and you're just gonna put the tongue on the roof of the mouth, apply a little bit of pressure, and from here, slightly tuck your chin, like as you would want to create a double chin. Don't do it too aggressively, just a couple of centimeters back. Hold the tongue on the roof of the mouth. You're gonna feel your deep neck flexors contracting, and you're gonna hold that for 30 seconds, relax for 15, and do it 6 times. This should give you some improvement. Do try to go through all the techniques, because this is gonna create a better environment in your body so that the other techniques are gonna work more efficiently.